The Axoguard HA Plus that I've been using have been in revision cubital carpal tunnel situations. I also have been using it for a protector and wrap for nerve transfer surgeries, particularly the anterior osseous nerve to the ulnar motor nerve. I can wrap it around the nerve transfer site and create this nerve sandwich, if you will. And it conforms so nicely and it handles so well that I'm able to have great confidence in the strength of the repair and allow early range of motion for the patient and know that I'm not compromising the integrity of that nerve transfer. There's a lot of cool things that are about it. Just the technical way it handles, the way it really does do a great job of wrapping and protecting the nerve, the way that it takes a stitch. I think that once people begin to get it in their hand and begin to use it in the operating room, they'll see that it's just so much easier. I'm excited to incorporate the Axoguard HA Plus into a lot of my traumatic injuries moving forward. I think that it's going to provide a way to globally protect the entirety of the nerve repair from end to end. Instead of just a connector sort of repair, we can almost create this HA sandwich. So I think that that's going to be a really beneficial thing for our patients. And I think that pretty much any time before I was using a nerve wrap or a nerve protector, I'm slowly beginning to migrate the entirety of my practice over to the HA Plus nerve wraps. I think if you're considering trying the Axoguard HA Plus, and I think the first thing to do is just get some experience with the material. Use the material, see if the material can be used in a non-surgical sort of setting, whether it be on a bench somewhere or in a cadaver lab, and then begin to incorporate it into cases that you are very comfortable using nerve protectors or nerve wraps in. And most hand surgeons are pretty comfortable in a revision carpal tunnel or cubital tunnel situation using these sort of products. So begin to incorporate it there, and then as you become more comfortable with the workability of the product, then I think you begin to incorporate it in more complicated cases like a nerve transfer.